My name's Cy England. We've had the pleasure of meeting many times at the VA meetings. We're here doing the Empowering Native Wellness podcast, and you're a very familiar face here at IHC. You help out a lot with the veterans, and give us a little background on how you came to become this veterans. Well, not a veteran, but you are a veteran. I'm a veteran, but how you became this person, this liaison with the VA for IHC.
Well, it's sort of. My name's Ray McMurphy. I am right now. I'm a quality consultant at the VA in San Diego. 39-year military veteran. This sort of fell into my lap right before COVID. What happened was one of the executive leadership team members came to me and asked if I would be willing to help with the Indian Health liaison portion, which is basically managing the agreements, and we'll get into the agreements a little bit later. And when I first started doing this, I found out that nobody really was coming out to the facilities. Nobody was reaching out as a face of the VA with the Native American veterans. So I started coming out and making contact, and then unfortunately COVID struck. But as soon as we started having meetings again, I became a member of the American Indian Veterans Association, which meets here first Fridays of the month. I want to plug that a little bit. You guys do an awesome job as far as that goes. But, and it sort of grew, because initially it was just an annual report on a few measures that really didn't mean a lot. Mm-hmm. So what I turned that into was more of a liaison, more of a reach out, more of a touch bases with our Native American veterans that actually meet here. And the veterans here represent almost all the tribes in the San Diego area. So it's a really great opportunity to reach out and to be able to help. And so what I did is reached out to our national level, reached out to other people, tried to find resources in order to help. And I've developed this into more of a liaison position rather than just managing the agreement. Right. So it's, in my opinion, it's what I do. And one of the reasons I had taken this on, my stepfather was Native American. Okay. My grandmother grew up on a reservation in Oklahoma. I didn't know the history, didn't know anything else about it. And when my great-grandmother on my mother's side passed away, I didn't find out until the funeral that she was a missionary with the Klamath Indians.
Oh, okay.
And so she had years that she spent with the Klamath Indians. So the Native American portion of this sort of reached out to me, mm-hmm. and it means a lot. My grandfather was one of the most important people in my life on my stepfather's side, and I feel like I'm able, as a veteran, to give back to the veterans, but able to give back to the Native American community for what I gained from my grandfather.
Right. Now, being a veteran myself and being Native American, I've come across there's a lot of stuff that we don't know, mm-hmm. When it comes to the VA. Yeah, you get these, when you're getting out, you get this little school that they put you through, and sign up for this, make sure you get your medical, all your medical portions accomplished. But there's a lot of stuff that Native Americans have available to them, mm-hmm. that we don't know about.
Exactly.
I definitely didn't know about, until I started attending, these our meetings and stuff every month. So right. Can you talk a little about that?
Unfortunately, and I spent a couple of years later in my career. I cross-trained into medical, became a nurse. I spent a couple of years as the commander of an Army Combat Support Hospital, and during that time, I was trying to pay attention to what was going to help my people, my mm-hmm. troops. And the out process, when you either retire or leave the military, is lacking in information, mm-hmm. specifically for Native American veterans. And what they don't get is the fact that, no paying copays. If you're Native American, it doesn't matter what your percentage of your disability is. Right. You don't pay copays. And in the VA, I believe it's at the 50% point where you no longer pay copays. There are additional benefits to that, and a lot of it's just knowing, just being able to reach out. And unfortunately, in that whole process of leaving the military, a lot of people say that, it's the information's there, they just have to take advantage of it. It's not. Mm-hmm. When I out-processed after 39 years in the military, it was very vague on what I needed to do to really take advantage of being a veteran and my VA benefits. Mm-hmm. And took a position. I went from active duty to reserve. I was working for the VA, and it still was a mystery. And I worked for the VA. And so my whole thing is to try to make this as transparent as possible for our veterans, for our Native American veterans. And really, we've been trying to make this a national push. Some of the posters I've done, they have the basic information. I've sent those out nationwide, just some basics, are you a veteran? And doing from there. But you hit the nail on the head. When you leave the military, it's not a cut and clear process at all on how to do this. And then, like you said, on top of that, there are benefits for being Native American.
And what sort of, when you do your liaison portion, what types of resources do you provide for Native Americans?
We've been, well, main thing is face-to-face contact, letting them know we're there. And we have some veterans, even in AVA here, American Indian Veterans Association, that have been reluctant to follow up on their benefits. A lot of your Vietnam vets are still under that cloud, In what we do, we reach out. We've done some of the direct things we've done, like the PACT Act screenings. And what the PACT Act is that had you been exposed to certain things during your military career, depending on what theater you were in, the period of time you were in, and if you're having ongoing health problems related to that, what we do is we've been doing the initial screenings. I brought the person who is the actual PACT Act person for the VA here in San Diego with me to some of the events, and we actually sat down with the veterans and were able to screen them. And what that means is it gives them the opportunity to relate and link those health problems to this exposure event, the PACT Act, and be able to increase their percentage of disability.
We'll talk about a little bit about barriers. Now, you touched on there's a lot of reluctancy.
Absolutely.
Now, would you say the reluctancy is across the board with veterans, or would you say it's more with the veterans, like you said, in the Vietnam era? Do you see a lot of that where they don't want to come in, and I'm a veteran. I was in the military. I don't need any of that stuff. I don't need any help. But they're missing out on so much.
Exactly.
Everywhere from back pay to just their family being taken care of to themselves in the future. There's a lot that they're missing out on, right?
Well, where the reluctance comes in, there's a couple different areas. First of all, the Vietnam vets really there's a big issue there. There's a stigma that against the VA. We've had some negative things in the press about the VA.
Right.
When you look at the VA as a whole, and there's different types of measurements that are done for all hospitals, not just VA. We're talking all the civilian hospitals. We are, even though the negative press stuff, one of the top-rated hospital systems. Yes. We are the top-rated hospital system in the nation.
Right.
In the nation. Unfortunately, because we are government-backed, there are political... how would I put that? There's sometimes politics gets involved, and they amplify the negative aspects rather than looking at what positive things we do. Another area is from the Native American population. There's mistrust with the government.
Right.
That's historical as far as the mistrust of the government, and that, we do a lot here to try to really get people to be. People know me here.
Yes, we do.
They're not afraid to come up to me. They're not afraid to tell me the problems and tell me what's going on. But the main thing is we're making an effort to combat that. And it takes time to change a culture. And the cultural problems that have happened between the Vietnam vets and Native American veterans and our government, wow, it's a really hard nut to crack. It's one there. But
right.
In the past, I started this in 2019. This is my 6th year doing this, and it's grown ever since. I think that I've been able to reach out and make those contacts, and I feel that I have the trust as a member of AVA,
right,
of the people there, and doing what I can. Sometimes it's difficult. Sometimes the VA itself throws roadblocks in.
Yes.
We had some things change where I had to get permission to come to the meetings. And they just pulled back in some areas, and I think I've gotten past that now. We're making some progress.
Yeah, since being here, the culturally informed care that you've provided, the information that you've provided, has been absolutely astounding from my perspective.
Thank you.
And bringing in those individuals who are reluctant, how would you handle, like your first conversations? Because I've sat through many different associations and stuff with the VA, and just to get them 10%,
Anything.
anything at
Even
all.
zero gets their, our younger veterans who have children, even a 0% gets them for California. Their kids have a free ride in college
Yes.
for the state schools. I mean, even at 0%, and they just got it really, and most of the time, it's hard to get to the process. Even getting zero sometimes is a painful process. However, you just got to reach out and do it.
Since your time collaborating with all the tribes and building these relationships, can you share an example of a successful collaboration between the VA and the tribal community in raising, say, their percentages, or bringing even more vets in? Because normally it's just such a close-knit VA, the veterans community, right? We're so close. There's hundreds, thousands of veterans.
Exactly.
There's hundreds of thousands of Native American veterans, but getting that word out to them.
Right. It's been difficult, and
Okay.
and the main thing is like here, the best thing we've got going is AVA, American Indian Veterans Association. I can't say enough about that. And what happens is the exposure that we get through AVA. And I joined AVA. I am a participating member. I come up. But what's been great is we've also had the Veterans Benefits people show up to the meetings. The cemeteries people show up at the meetings. They're here. And the people know that we regularly are here to support them. And the more they see us, the more comfortable they are talking to us, the more we're able to help. Some of the success stories, well, one, as far as Native American veterans, I'll give you an example. The tribal facilities all had agreements. And what the agreement means is the VA has agreed to reimburse the tribal facilities for health care provided to qualified veterans. Right. And there's a couple things in there about qualified and things like the detail stuff. The main thing is we do it. Unfortunately, in order for this is the only facility of the 3 in the county that actually is participating in that right now.
Okay.
They are active. You have the people here. Corinna has been amazing as far as moving that forward. Her and Orvin have been here forever, and
Right.
it is hugely, hugely beneficial to the Native American veterans. San Diego American Indian Health Center, which is an urban facility. Now, the money comes from a different pot of money, but it's for the urban facilities versus tribal, so it's not a competition. But the main thing is they take care of veterans that are not part of the tribal facilities here. They didn't have an agreement. And in 2022, they made it possible for the urban facilities to get agreements. And I reached out to Kevin LaChapelle, who's the CEO there, and he says, Ray, I've been trying to get somebody to help me with this. And I said, what do we need to do? We sat down in October of 2023, and by January of 2024, I had their agreement in place.
Wow.
They were only the 6th in the nation. And what that does is we're the second largest city in California. We have the Native American population in San Diego that is not affiliated with one of our 18 recognized tribes is huge, huge. On top of that, we got them listed as a community care provider. And what that means is the VA, Native American or not, can now refer veterans to their facility. Southern Indian Health is working on that right now to do the same thing, moving forward in trying to get that. Sikwan's new facility was just completed, and they're moving forward in those areas too. So it's been great. So that was probably, as a large thing, one of the biggest things that I've been able to help with when it comes to the health of American Indian, Native American veterans. Here, I just feel that it's those little things that are really big in my mind, like one of our members coming up to me and, Ray, can you help me with this? I have to get permission from them because in my capacity, I work in quality.
Right.
So I have access to the medical records and everything else. I get the permission, have them sign a release, and I'm able to look at it. And I was able to reach out for a couple of the veterans directly to their provider and say, hey, what's going on with this? I'm not a social worker.
Right.
I'm an ER trauma nurse by trade. I work in quality though. But I feel personally that I can reach out and touch those places that can help our veterans here. And that's happened with a few of the members. I was invited to be the MC for the annual powwow that they hold in Balboa Park. And I was the MC for the veterans recognition portion of it. And we had not only tribal members from our area, there were tribal members from throughout the Southwest region. We had tribal members from states 1,000 miles away.
Wow.
That were there. And we were able to, and of course I plugged Ava.
Right.
But the main thing is for me to be able to speak out, to recognize those veterans and let them know that we're there to help them, support them in their health, it makes a difference. And one of the biggest things is the member themselves letting their tribal facility know that they're a veteran, because sometimes they don't even tell the facility.
Right, and they're missing out on that. The facility
is
missing out on that reimbursement.
And that's one of the ways I sell this also to that veteran. They may be reluctant, in themselves, but I explain to them, hey, it's not only helping you, which is the number one thing in my mind.
Right.
It's helping your tribal facility.
Exactly.
Because those funds coming in that reimburse them for your care help the tribal facility to care for more veterans, care for more people of the tribal nation that get their care here.
Right.
So it benefits not just them, their facility, but every tribal member getting that care.
The community as well.
Yes.
So you spoke on, we're talking about reimbursement. What can IHC, what do you see that IHC did differently that could help our brothers and sister communities and tribal clinics?
The thing is you guys have been positive, and I've used you guys as an example. Last year in November, I had one of the people from National come here and actually do an education piece to all the tribal facilities on how to get the reimbursement process going, how to utilize that, what the pitfalls are. Corinna and her staff work with this stuff, and I use them as my experts.
Right.
They are so supportive. I talked to the people down at Sikwan and Mo's people down there, Maurice Smith. There are people at the health facility reach out, and they contact you guys here because you guys are the ones doing it. And I'm so proud that this is one of the facilities I'm affiliated with. You guys are really making a difference as far as how that goes here as the leaders in our area.
Tribal leaders. What impact does tribal leaders have? Not only, we're not just talking about reimbursement, but as a whole with the American Indian and Veterans Association.
That's my next step. I've reached out through Maurice Smith and through Orvin, and we're trying to set up to where I can speak to the individual tribal. They have meetings where all the tribal leaders are there, and I want to be able to speak to the tribal leaders because I'm not sure they are clear on exactly what we're doing.
Right.
And I want to be able to directly speak to them as far as the details and how much their facilities have done in moving this forward. And I want them to recognize that. And I think the awareness alone is, with the tribal leaders, will do nothing but help in the future. Funding, expansions, things like that, where they get a better feeling for what's going on and how important it is for the VA to partner with the facilities.
Do you see any time in the future where technology will help advance this?
Yeah.
I know we're in the AI mode. We're in the era of AI, and computers have been around for a long time. Do you see any hindrance from technology helping out or advancing it? Because you are a very boots on ground individual, and you've touched many lives when it comes to veterans. You are the go-to person when anybody talks about veteran stuff, your name is mentioned, Ray. And so do you think that that boots on ground mentality will continue, or do you think technology itself
Well,
will be a hindrance?
as long as I'm here and doing this, the boots on ground's here.
That's right.
However, in moving forward, the VA itself is upgrading their capabilities as far as our electronic medical records. And a lot of the tribal health facilities have already gotten to a point where they're moving forward.
Okay.
The VA is a big ship. It's hard to turn, but we are upgrading our computer systems to where they can actually talk to each other.
Okay.
It would be great for your physician to be able to go in, pull up one of the patients and look, oh, the VA did this, the VA did this, and collaborate. We can't do that yet. We're getting to that point.
Okay.
We're moving to a different computer platform for our health records, and I'm hoping in the future that it'll be more conducive to patient care. I worked in healthcare systems before where we were able to log on and with the patient's permission, reach out to the other facilities outside of our system and share the records.
Right.
Because that is so important for understanding what's happening with the patient. I do see that coming in the future. I do see that as far as one of the goals we have as far as improving what we're doing.
And just marrying up the technology with, like you say, boots on ground. For instance, just myself, I love the face-to-face and having the person there when I go to the meetings. Hey, I need to try and get this percentage raised. What can we do? Instead of waiting online or waiting on a phone call with the VA. So I hope the whole face-to-face never goes away.
Well, unfortunately, with the shutdown we had, the VBA, they weren't able to participate. I came up anyway. Main thing is the VBA guys are great, and they're the veterans benefits guys that get for those veterans that haven't even got their foot in the door. They're the ones where you have to go there first. You've got to establish the fact, one, are they an eligible veteran?
Right.
And there are certain criteria for that. And then moves on from there. And then also the VHA, our people at the hospital who do the healthcare enrollments have been coming too. So when we have events in the future, we have VBA there, which is the overall benefits. I mean, your VA loans, your student stuff, all that good stuff. Then the veterans health people are there to enroll them in health and really do that specific piece of it. And it is a two-part process that really has to be done in order for that veteran to really take advantage of what they're entitled to.
And now, for those veterans who are processing out, becoming veterans, they haven't gone through this process yet. What can you say to those individuals to kickstart this process easiest?
One of the main things is understanding there are benefits. The other thing is understanding what qualifies you for the benefits. And there are certain time frames in I was in the military from 1980 to 2019. So I covered a huge span.
Right.
So I picked up a couple wartime things and some other stuff. So mine are pretty cut and dry benefits. However, those that it served during certain time frames may not be eligible for as many benefits because of if it was a completely peacetime operations during the entire time, no declaration of war, no campaigns and stuff like that. It's convoluted. But what I'm going to tell the veterans out there, here's the thing. If you have an ache or pain or something's wrong, go report it.
Right.
Here's the problem. And I'm probably the same with you, I'm a lot older, but in my younger days when I was doing the crazy stuff, I wouldn't report injuries.
Exactly.
I wouldn't report the fact that when I fast roped out of that helicopter, it took a dip and bounced me off the ground, and my back hurt so bad I couldn't walk for 3 days, because if I reported that, I'd get pulled off a mission.
There was a stigma behind it when we
absolutely,
and you're not going to get deployed. You're going to be undeployable.
You're malingering.
Guys,
Yes. You're malingering. What are you doing? You're putting it on your teammates. It was between the fact that you get pulled from missions, because I loved my missions. or that stigma. You didn't
Right.
report things. Report it. Just report it.
Report, yes.
My son's in right now, and I tell him to report everything. You're not malingering. What you're doing is you're ensuring that you get cared for in the future for those
Exactly.
things that happen in the military. My back issues have never been recognized in my VA claims. They keep getting denied, and I have major back issues. Literally, fast roping out of a Huey, getting bounced off the ground
Yep.
because the Huey took a dip before you got off the rope, and you're getting bounced and drugged. We used to do a spider crawl off of a 2-story building and drop down. It was all the stuff that I did, but I refused to go to the doctor in the VA because at the base because I get yanked from a mission.
Exactly.
And I wasn't going to get yanked from a mission. There's no way. Even my tinnitus took some fighting because they denied it at first. I'm like, wait a minute. I was a weapons person for 20 years. I sent them pictures of me shooting everything from handguns, rifles, sniper rifles, shoulder-fired weapons with no hearing protection. I have pictures of all that.
Yep.
And they denied me the first time. I'm
Yeah.
like, what? There's certain key things that have to happen. But the main thing is those troops, go and report
Yes.
it. Report it. Because if you don't report it, it didn't happen. And there's nothing you can say. I mean, buddy letters do help.
Right.
I had a friend that I helped get his VA benefits who was shot. Basically, it was a flesh wound, no major damage, was treated in the field and went back out. He was in Somalia. And it never got in his medical records. He had to have a buddy letter say, yeah, he got shot. The medic patched him up and going from there. And he's developed some issues because of that later on. But he couldn't prove it in his records.
Yeah.
Those buddy things are important, but report it. Just report it. You have to.
And this is make sure to all those veterans who are new veterans, if you're Native American or if you're not and you're just a veteran,
Absolutely.
find a veterans association,
That helps.
attend the meetings. The amount of knowledge
Yeah.
that goes on that's passed down in these meetings is incredible.
Right.
You know, I got out and I was the same way while I was with Jay Sodif and Joint Special Operations,
Yeah.
and so if we report, if you report something, you're not going to go. So
That's it.
I went my whole time without reporting things, and then when I got out, I was like, oh, I feel great. Things add up over the years.
Absolutely.
You know, that can be tied back to something that happened to you in the service. And I didn't know a lot of this stuff. And so when I first attended, your meetings and you were there and you sat down, my mind was absolutely blown away.
Yeah.
Of all the stuff that I could apply for and get the process started and was eye-opening.
Well, I appreciate that, but I'm not the expert in those areas. I just open the door, get you where you need to go, and get the people to help you and what you need to do. And it's like some of the injuries that I had. I was sort of surprised I have ongoing shoulder issues, but I didn't even think about it. I was in the field in Iraq. Something happened, and I hurt my shoulder, and I actually went to, even though I was working in a forward surgical team, I couldn't get care. I had to go over to the medic and get care there. He documented it. It made it to my medical records.
Yeah.
And so I was able to get a claim because I have an ongoing issue with some stuff in my shoulder. And it's even that simple, just make sure somebody's reporting it. And I
Exactly.
didn't even, to be honest, that medic got me a good percentage because he actually documented it.
Right.
Document
Got
it, have it in writing. And if you get, nowadays your medical records are not like the old days when we had a paper medical record.
Right, just your big book.
Before you get out, ask for a copy. And time enough that you have that copy before you get out because you want to make sure everything's there. Because there's something missing in it, get on it before you get out and make sure that gets taken care of, because there's just so many times where you get those things that happen. Well, I thought it was there, but it wasn't. Get those medical records, request them in writing, go through them, and make sure everything's there.
You have a lot of passion behind everything that you talk about. Where did this passion come from?
Oh, wow. For the support of the Native American portion of it, absolutely my grandfather and my grandmother. Absolutely. My grandma, little 5 foot nothing. Grandpa was 6'2", and she literally grew up on a reservation in Oklahoma. But my passion to take care of my fellow veterans came from being in the military for 39 years. Between active duty and reserve, I spent 39 years in. Some of the more fulfilling assignments that I had, one was being the commander of an Army Combat Support Hospital. In that time, I had 250 people working for me, everything from truck drivers to neurosurgeons. And the sense of being able to help my fellow veterans and then being able to work for the VA. When I came back from Iraq, on my last combat tour in Iraq, 2011, I was a patient at the Milwaukee VA. I had the greatest care, not the greatest facility, it's an old facility, but I had the greatest care from the VA, from the nurses and the doctors and everybody there. And at the time I was looking to move back to California. I left active duty, was going back to the reserve, and I decided to take a position with the VA.
Okay.
And I was so impressed with how I was treated. I wanted to treat other veterans that way. And the thing is we have a lot of people working in the VA that are not veterans. And I think that just that extra compassion and knowledge from being a veteran, taking care of veterans, makes a difference for me. It really does. It's huge. One of the future podcasts we're going to do is on suicide prevention.
Okay.
Huge, because our numbers are great. And unfortunately, it's higher in Native American veterans than it is in veterans themselves, as far as the numbers go. I received a phone call from a really good friend of mine. We were both in Iraq together. And I answered the phone, and he was just crying and sobbing, and we talked for almost 2 hours. Got him calmed down, made sure everything was going okay, made sure I waited on the phone till his wife got home. And what was interesting was the following morning he calls me back and says, "Ray, look, thank you. I'm in a rehab program now." He says, "Had you not answered the phone, my gun was in my hand." So I tell the veterans, if a fellow veteran calls you, you always answer that phone.
Always.
No matter what time of day it is, you answer the phone. And it made me realize how many of us out there, we need people that care. We really need somebody that cares. And fellow veterans, I mean, it's hard to say, and you're a veteran. I don't talk to non-veterans about the stuff I talk to veterans about.
Exactly.
And if you're not a combat,
there's a connection there.
If you're not a combat vet, you probably won't understand some of the stuff that I would want to talk about.
Right.
Because my first 20 years were not in medical. They were doing other things. And I think with that perspective, it helps. I used to get calls when I was working as a nursing supervisor at one of the VA hospitals. I would get calls in the middle of the night to go in and help talk to a veteran in the emergency room who was having a crisis. One of the veterans, I felt so bad for him. He major issues, PTSD issues were just off the hook. But when he'd come in, I would go down in the ER. They knew if I was working, I'd go down and talk to him and be able to calm him down. And I'd walk into the room, he's hiding behind the bed. He's like, "Gunny, they're behind you."
Yeah.
Hallucinations and stuff. But I would be able to talk to him. As a veteran, we've been there.
Yeah.
We can talk to them. And I feel that's what I'm able to give back. And I truly do have, it's in my heart. I want to do it.
And we thank you greatly and deeply for having somebody like you with the passion that you show and not only to Native American veterans, but to veterans as a whole.
Well, I appreciate that.
Speaking to the disconnect, we'll go back a little. The disconnect there is between, especially Native Americans and the government. There's a huge history of that.
Oh yeah.
What can you say to Native American veterans to get over that disconnect, that mistrust?
One of the things is understanding it is cultural. Understanding there is a history behind that. Understanding it's it's not that it's unfounded. It is absolutely, that fear is founded. It's basically letting them know that there's people like me out there that do care.
Right.
That we will watch them. We do have their back when it comes to this stuff. And then explaining to them how it not only benefits them, but it can benefit their family, and it can benefit their tribal health facility, other Native American veterans, and other Native Americans. How just their participation and being willing to just take that first step helps so many things. And granted, they are the most important piece of that veteran, and that's my focus. But letting them know that it's not only themselves, but how many other people this touches in their lives and how that helps. And that's usually where I'm able to get them to go past that. There's been a few that have been just steadfast in refusing. And that's fine. You know, that's their choice. But do they need that care? And it's, the ones that can afford their own health care, that can afford to do things, or they're being taken care of here, that's great. But the ones that can't, that's where I really make the effort. And I get other fellow veterans to join me in this.
That's what I was going to ask. Do you employ other other veterans, you know, that they know, you know, or not know, you know, to help push them along into the right direction? Absolutely.
And what's great about the Native American veterans is their if their family is not a veteran, but they're Native American, the families also get health care here. And this is what I try to push out to those veterans that aren't taking advantage of some of those things. You get veterans that are low income, that are needing that just that little bit more. They get their, even if they get their care at the VA.
Right.
Just what about your family? You know, if is your wife Native American? You know, reach out. Are you part of one of the 18 tribes here? Reach out to the facilities. If not, go to the San Diego American Indian Veterans Center, or the San Diego American Indian Veteran Clinic. They're amazing down there. Kevin LaChapelle is the CEO, and the ones here. Orvin is amazing. Orvin Hansen, who's the CEO here, just absolutely amazing. Been here for over 30 years. And they are so dedicated and support the veterans. It's amazing. Maurice Smith at Siquan. Laura Caswell at Southern Indian Health. And like I said, Kevin LaChapelle down at San Diego American Indian Health Center. Key people. You've got people that are so passionate about helping the veterans. I look at you guys and say, hey, I want the VA to be sometimes more like you guys, because you are the VA's there.
Right.
But the cultural differences and the understanding and where it can go from there. The tribes are a community that takes care of their own.
Speaking on the cultural differences, there's holistic medicine, and then we have, you know, our modern Western medicine. Is there any disconnect there, or would there be any disconnect, or you know, oil and water type thing that they have? Like some of the Native Americans will do a sweat lodge or some aspect of their cultural medicine. Is there anything that would prohibit the VA from, you know, seeing them or updating the records or whatever?
No, that all can be included. The main thing is as the differences are in the reimbursement portion of the process. The sweat lodge itself may not be reimbursed by the VA.
Right.
However, when it comes to medications, and if you have some herbals and tribal-based traditional medications, we reimburse the facility. And it doesn't have to be on our formulary, which means it doesn't have to be on the VA's list of meds.
Right.
If the tribal facility provides it, they can bill for it.
That's fantastic.
So that's one of the things. And I'm sure there's some stipulations there that are those things in the weeds. But the primary thing is we don't restrict the tribal facilities from what they can provide to their veterans. Now, the sweat lodge piece of it, I know that they're talking about there's going to be a tribal event, or excuse me, American Indian veteran event that's coming up that's going to be at Sikwan. They're talking about doing a sweat lodge there. It's something to look into. What can we do? What I'm looking at doing is we have certain information on cultural needs of our Native Americans when it comes to healthcare. I want to do something a little bit more localized. I want to do something that's based on our local tribes, because you can't look at the Native American population and say they're all the same, because you're not.
Right.
It's the cultures are different between the tribes in different areas, different regions. And I want to be able to put together, with your help, a guide to treating local Native American veterans.
Fantastic.
So how to respect what they're, because the thing is, and also it helps to explain to our providers what that Native American veteran values in their health care.
Right.
So that's something that you and I need to work on moving forward.
We definitely will. Yes. Your proudest moments. Your proudest moments. I know you had a hand in Ava. I know you've seen the growth, exponential growth, I presume. What are some of your proudest moments as a VA liaison working with Native American tribes?
I think my proudest moments is the response you gave me just a few minutes ago, as far as when the question comes up as far as the VA and healthcare, they think of my name.
Yes, we do.
And I want that. I want to be able to help. And it makes me feel good. It makes me proud to know that I've been able to give to the Native American veteran community and the facilities. I've been able to make a difference. I have been able to be a part of a lot of different things that have happened. It's amazing. I truly appreciate everything, but just that recognition that I'm making a difference, that's what counts.
And 5 to 10 years down the line, what do you see, or what do you want to see the VA do with Native American tribes?
Oh, there's a couple things. First of all, a better cultural understanding. I think we need to work on that as far as that goes. The agreements are working. Maybe, like you said, let's look at sweat lodges. Let's look at some of the other cultural things that we might be able to do for the Native American veterans. But in moving forward, there are some things that we can do to make it easier for the veterans to get health care. The example is, when the San Diego American Indian Health Center got their agreement, and they reached out and went beyond that and became a community care provider for the VA. Unfortunately, the way it works now is it doesn't list their facility as a provider. It just lists the individual physicians, which, as me as a veteran looking for health care, what I want to do is be able to say, I want to be treated at Indian Health Council at Rincon. I want to be treated here. And if you're listed as a community care provider as a facility, I can request that as a facility rather than having to know, I want to be treated by Dr. Jones and try to get that happening. We shouldn't have to do that. You shouldn't have to, you should be able to say, I want to be treated here.
Is that something that the facility, us, Orvin, can we request that to be changed? No, we can't.
This is why I said the VA, this is some of the changes. This actually falls under TRICARE. And I brought it up at one of the national meetings earlier in the year, that this is an impediment to getting the care. Because if I know the facilities here, I don't know the specific physician, but I want to be cared for here, get referred to one of the people here to be coordinated, a care coordinator to that. I should be able to go on and say, I want to be treated Indian Health Council at Rincon, and be able to get the referral. And that's one of the things I think we can improve on. In moving forward, like you said, I think that as we upgrade our electronic medical records, have them be able to talk back and forth. I think we could have some better collaboration as far as that goes. this year was a lot of things happening, but next year for November, which is Native American Heritage Month, we're looking at having a larger event and inviting each of the health facilities to have a table there. Last year we had the Palma, the bird singers there.
Right.
They were amazing. We had drummers there and everything else. Next year we're going to plan on a little bit bigger thing where we invite everybody, and it'd be a annual event to where the leaders come and can talk to each other. Dr. Pearson is our leader of our hospital, and he's extremely busy, but he keeps telling me, Ray, I want to come out to the tribal facilities with you. So I'm trying to set up some meetings to have Dr. Pearson come out. And as the director of our hospital, he's in charge of all the VA that happens in the San Diego area, our county, all the way out to Imperial.
Oh, okay.
So that's the man.
So you have a lot of outreach.
A lot of outreach.
A lot of outreach.
We got a new rural social worker. We had one before, Jasmine, who was great. I'd come out here in Jasmine to be here working with the people from the VA. I just loved that. Because when I first started, that wasn't happening. And then I got going, and Jasmine's coming out. Jasmine left, and we have a new person that's here now, and trying to integrate some of this stuff. I'm going to be doing the first meeting probably in January, February. We're trying to get it put up right now, where it'll be our first meeting of everybody in the VA San Diego who touches Indian health, because right now it's not coordinated. I'll get phone calls from the facilities going, hey, Ray, so-and-so showed up. Do you know who that is or what's going on? And I don't.
Right.
So I want all the VA to be on the same page as understanding what all we are doing for the Native American health facilities. And what that means is suicide prevention, mental health, women's health, VBA, VHA. I want all of us to sit down at the table and say, what are we doing for you? And then be able to do a one-page sheet that says, here's the number and you need to contact. A one-page sheet that has all the good info and who to go to.
Continuity of care.
Got to.
You have to.
So we haven't done it yet, and I reached out to one of the people at the VA. She's going to be helping me put the meeting together. We're looking at the end of January, February.
Okay.
We'll probably do multiple meetings for the VA just to get us coordinated. And this way here, when I come out and talk to Orvin, I can hand him a list. Hey, Orvin, this is the coordinated list. If there's anything going on, let me know, and we'll go from there. And for them to understand, because to be honest, a lot of people at the VA don't know I'm the liaison. So letting them know we have that there, and
That's
that we
surprising
have
to
the
me.
established contacts.
Your name just resonates. That's why it is. It's surprising to me that a lot of people don't know that you're
Not as much at the VA, because we're sort of siloed.
Okay.
And we're trying to break down those walls and break down those barriers, because there are some barriers. But we have some great people that are working on these programs, and I've got the commitment for support in a lot of these areas.
We don't want to lose you. We want you to stay our liaison.
Well, you're
forever.
stuck with me probably for about 5 years.
Okay, so 5 years. Do you have somebody in mind that will fill your shoes? Because I don't know too many people who are going to be able to do that.
Well, to be honest, this is an additional duty. It's not even it's not technically. I have made this part of my job.
Okay.
Technically, it's an additional duty that was passed on to me by the executive leadership team, and I've made it into something a little more. We've been recognized, as far as what we do here, as one of the leading programs in the nation. When what we do, the amount of time that we spend together, and what we're doing for our veterans. There's one of the other programs in Arizona that's doing a tremendous job, and I'm trying to reach out again to him and say, hey, what else can I do to make this better? I'm always trying to constantly improve. But because it's not a supported position, I'm working on who we can put into the position.
Right.
It may not be a quality consultant, which it probably may end up in, who knows? It'll end up somewhere. But I'm trying to find somebody that can, because my office partner right now, there's 14 people in my office. The person I do most of the work with, he and I will both probably be retiring about the same time.
Okay.
So I'm trying to find somebody young that's enthusiastic and as a veteran.
Right.
It doesn't have to be, but I really think that having the experience as a veteran and the understanding. And if they're Native American, that would be tremendous. But the main thing is having that understanding and the compassion and passion to go out and move things forward.
Right.
So that's what I'm looking for.
Do you see any barriers today that hold back a lot of Native Americans moving forward with the process of establishing themselves within the VA system?
The barriers pretty much are the barriers that we've had for a long time. It's that the reluctance to reach out and ask for the help. It's the cultural issues that have been there throughout history as far as between the Native American tribes and the government.
Right.
I think those are some of the biggest barriers. And the other thing is just getting the people out there. We are so lucky here to have the people that we have coming. When you get the VBA guys coming out, the benefits guys coming out, they show up at when they're not laid off. They show up at the meetings.
Yes.
Those guys know the stuff.
Yes, they do. Yep.
They know the stuff, and that's who you want here. In my position, some of the barriers have been basically looking at it from a national level as far as understanding and support. I don't think we're as organized as we could be in this. There's a lot of great things going on, a lot of great things. And moving forward, there's different initiatives and stuff like that that have come up. But like I said, the barriers are, one, finding somebody that comes out to do what I do is going to be tremendous, because if you don't, originally before, they didn't even go out to the tribal facilities.
Right.
They made one phone call, sent a couple emails, and if they got a response, fine. If not, that was it. And it was a report that was done once a year that nobody listened to. Now they do.
Right.
They see it. They see what we do. I was invited to speak at one of the national events, matter of fact, Art here. I was speaking at one of the national events for Indian Health. I was invited to speak for the American Association of Ambulatory Care Nursing, which was a national event based on Indian Health. They wanted to know what we were doing and how they can emulate what we were doing and what tools we could provide to them. And it's just things like that in moving forward that whoever is in this job just got to be willing, just, hey, think outside the box, just go do it.
And see, that speaks to yourself and your tenacity towards this to speak on a national level. They're asking you what you did here, so that they can emulate that. That's fantastic. Now, you spoke about some initiatives that are coming up. If you'd like to touch on some of the initiatives.
Some of the initiatives, well, these are some of the past ones, but the main thing is understanding that some of the things that have happened and some of the significance of these. I'm going through some of these notes here. Also understanding the history of what it means in this area is my page here. Here we go. The reimbursement program is one of the biggest things, I think, that came about. And they started, do you know that started here?
Really?
It started with Rincon. It started with Indian Health Council. It started...
Trailblazers.
Well, the thing
with
is...
your help.
Well, one of the things I point out to everybody, because they don't know how significant Native Americans have been to our military. Native Americans join, both men and women, the military at a higher rate than any other group, a higher percentage than any other group. And it's been that way for a long time. But as I get here, Ben Megante started this in the 90s. Him and a bunch of other people got together with Orvin, who was here at the time, and also Corinna, Orvin Hansen and Corinna Nyquist. Some of the people are significant in this. In the 90s, they started looking at how can we better collaborate with the VA. And they went back and forth, back and forth. In 2010, it was when the first MOU was signed, the Memorandum of Understanding. And 2012 is when the reimbursement starts. And it all started here. For the nationwide stuff, started here. And that, you guys should be proud. And you are. And Orvin knows it. Orvin speaks about it. A lot of the people here do. And understanding that. And that led to 2022 when the urban agreements were signed. And some of the significance that a lot of people don't know is San Diego County has more recognized Native American tribes than any other county in the United States. we might not have the overall huge population like some of the larger tribes in Arizona. However, we have more recognized tribes here. 18 of the 20 tribes are recognized by the federal government. And that's what I try to tell people. It's a huge part of our population, the history of the area, everything else, and it supports our natives, the Native American veterans on that, some of that stuff. Some of the information here is just some background stuff that I provide to people. They have a clinic where the VA actually goes out to some of the tribal facilities and has collaborated with some of them and have doctors and people working at them. Here we're close enough to where they don't have to do that. In there, you're going to see a map in there, the IHS VA map. And what that is, it's an app you can log on to as you can find out where your VA care can be provided.
Okay.
And then on the next page, there's also a website that I refer to that shows where all your tribal health facilities are.
Fantastic.
And this gives you the information there. And these are all features. One is on the IHS website, the other one's on the VA site, and I give links to all those things and the resources. But the main thing is moving forward is, like you said, the barriers are there, and I think the biggest thing is the reluctance of some of the veterans to get involved in some of this, and just understanding that it not only helps them, but it helps their tribal facilities, other veterans, and other tribal members.
Definitely, yes. And yeah, there's a lot of history throughout Native American, like you touched on, Native Americans within the military. And I'll put a little plug in there. My grandmother, Minnie Spotted Wolf, was the first female Native American Marine.
Wow!
Yes,
amazing.
Yeah, and she has they made a comic book about her during World War II.
Wow!
And it was called One Little Indian. And so I have that comic book, and there's another. I have a copy of it. It came out. I want to say it came out in like '64, and like I think it was a magazine for girls. I think it was just called Girls. But in the middle of it is her comic book, and you can Google it and kind of read through this little comic book, and it tells a story about her growing up on a ranch back in Montana, and it talks about her driving trucks and stuff like that. So she was a heavy machines operator in the military, in the Marine Corps, and the University of Montana has a copy of her stuff too.
That is amazing.
But yeah, so I mean, it's the passion's there, to help with the veterans, and on my side as well, and being a veteran, and celebrating that history, and to have that history, not only myself, to you, with all the other veterans, is been paramount. And I just want to thank you, not only from IHC, but for myself, because you did help me out a lot, and Art introduced me to you, finding out about the AVA, and going to those meetings and whatnot.
Absolutely.
And getting started. And so I just want to shake your hand, Ray, and thank you so much for everything that you've done, not only for myself, but also for the community as a whole. And like I said, your name comes up. Everybody knows who you are. And we, from the bottom of our hearts, thank you so much.
I appreciate that. Well, we just are going to continue to work together as we move on to just expand and do more.
Well, thank you for joining us on this podcast. Really appreciate everything that you've done for us.
Hey, thank you for all you've done.
Thank you.
I appreciate it.
Definitely.